Thank you for coming and welcome to this evening's business program, Untangling the Medicare Maze, how to ensure you're enrolled with the right Medicare coverage at the right time. I'm Ellen Jampel, business librarian at the Westport Library, and your host for this evening. Just a few little ground rules before we start. If you have any questions to ask our speakers, you can post them either in the questions and answers box or in the chat box. You have two options there. I'm pleased to introduce our speakers for the evening, Mark and Curtis Bentley of Health Directions of Fairfield County. Health Directions is a free, full-service health insurance planning agency in Fairfield, founded by Curtis and Mark. Curtis brings a balance of analytical skills and creative problem solving to the Health Directions team. His years of experience helping people understand their options in the ever-changing health insurance industry reassure his clients that they are enrolled in the right plan for their stage of life and coverage needs. A graduate of Marymount College, Curtis is an avid sailor and is highly committed to healthy living. Mark is proud of his ability to align health insurance planning with his clients' unique long-term needs and outlook, and to clarify complex issues. Committed to open communication and strong relationships, he ensures that the individuals, families, and businesses who put their trust in Health Directions are confident they have an advocate on their side. Outside of the office, you can find Mark enjoying exercise, travel, and spending quality time with his family. Please join me in welcoming Mark and Curtis. Thank you.
Thank you. Thank you very much, Ellen, for the nice introduction. And thank you, Westport Library, for allowing us to host this presentation. We are excited to share with you navigating Medicare enrollment. My name's Curtis Bentley, and my twin brother, Mark Bentley, yes, that's my twin brother, will be joining us on the presentation tonight. So tonight we have about 45 minutes. So it's not a lot of time to cover Medicare. So we're going to do a high-level overview and help you understand Medicare, the different parts of Medicare, and go through the different slides here. So let me get to our agenda here. Oh, go on the next slide. Oh, here we go. Okay. So you learned a little bit about Health Directions. We are a health insurance brokerage firm based in Fairfield, Connecticut. And we've been doing this for about 16 years. We work with the local community, and we help people get set up with health insurance plans under age 65 for people that have to buy their own health insurance. And then people who are Medicare eligible, turning 65, we help them transition into Medicare. So tonight we're going to talk about what is Medicare, who is it for? I'm going to give you an overview of the different parts of Medicare. There's parts A, part B, C, and D. Medicare likes to follow the alphabet. We'll also look at supplemental Medicare supplement plans. And then we'll dive into applying for Medicare for those who are approaching that age of 65 when they need to start Medicare. And then we'll take a look at the 2021 Medicare Savings Program. This is a program to help offset the cost of Medicare. It is income-based. So we'll take a look at the different requirements there. And then we'll set aside some time for Q&A to get some questions answered. So let's get started. Go to the next slide. So there's Health Directions. We've covered that. Thank you, Ellen. That's me on the left, and that's my brother Mark on the right. So what is Medicare? Medicare is the government-run health insurance program for individuals who are turning 65. It's also available to people under age 65 who have certain disabilities where they've been on Social Security disability for more than 2 years. They can qualify for Medicare. Or if somebody was diagnosed with end-stage renal disease or Lou Gehrig's disease, they would automatically become eligible for Medicare. So for most people, you've been working, you've been actually paying into the Medicare program during your working careers. You've been paying Medicare taxes. Those taxes that you pay fund the Medicare program. Now it's your time to take advantage and get your money back and use the Medicare benefits that you've paid into. So under Medicare, what the government does is they break Medicare up into core parts. So there's what's called Medicare Part A. That is your hospital insurance. So that's going to cover you if you had an inpatient hospital stay, if you had coverage for skilled nursing facility stay, if you needed hospice care or home health care. So under the Part A portion of Medicare, the government bases the number of cost shares that you pay. It's based on the number of days you're in the hospital. Also, the core part is Medicare Part B, which is the medical insurance portion. Think of that as all of your outpatient medical care. That's going to cover you for doctor visits, any type of diagnostic testing, your routine preventive services, outpatient care, outpatient surgery, going to the emergency room. And then there's what's called Medicare Part C, and that's referred to as Medicare Advantage. So what Medicare Advantage is, it's another way to get your Medicare coverage. So the government basically outsources Medicare to the private sector, to private insurance companies, and they administer and provide your Medicare coverage, and they set up networks of doctors, hospitals that agree to participate in the plan. We'll look at that in a little more detail in the upcoming slides. And then the other core part is Medicare Part D, as in drugs. That's the prescription drug coverage. That helps cover your prescription drugs, and that is run by private health insurance plans. So Part A and Part B, they do not cover prescription drug coverage. Only if you're in the hospital, that would cover your prescription drugs provided in the hospital setting. Okay, so I mentioned earlier that you have been paying Medicare taxes. So those Medicare taxes that you've been paying through your paychecks, that funds the Medicare Part A portion. So under the Part A portion, for most people, I would say probably 95% of US citizens, they do not have to pay a premium for Part A. There's enough money on that side of Medicare where the government doesn't charge a premium as long as you've paid in enough taxes of 30 to 39 quarters. So if you meet that requirement, Medicare Part A, there's no cost. And then on the right side, it says Part A, hospital inpatient deductible coinsurance. So under original Medicare, these costs are the costs that Medicare doesn't cover under the Part A hospital portion. There's a hospital deductible of $1,484. That covers you for a benefit period of 1 night all the way through 60 nights in a hospital setting where you get admitted, not under observation. And then what Medicare does under the Part A portion, the cost share that Medicare charges you, it's based on the number of days you're in the hospital. So days 61 through 90, you would be responsible for that hospital deductible of $1,484, and that's per benefit period. And then if you're still in the hospital, approaching days 61 through 90, that's going to trigger a new cost sharing where Medicare is now going to charge you a copay of $371 per day for those days 61 through 90. And then if it's something very serious where you're still in the hospital approaching days 91 and beyond, then Medicare is going to start charging you a copay of $742 per day. And they're giving you what's called lifetime reserve days, which is an additional 60 days of hospital coverage. After that, if you're still in the hospital, Medicare is going to charge you all the additional costs for the hospital. But you can also pick up a supplement plan to protect you from that. So that's Medicare Part A. Under the Medicare Part B portion, this is going to be your first cost under Medicare. Everybody has to pay a premium for Medicare Part B. Right now, the standard Part B premium in 2021 is $148.50. That's the standard Part B premium. However, under Medicare Part B, the government looks at your income and there's different income brackets. So if somebody was starting Medicare in 2021, the government is going to go into the IRS and look at your tax return from 2019. They always look at your income 2 years in arrears to determine what everybody pays for their Part B premium. So for somebody starting Medicare in 2021, they're going to look at your reported 2019 modified adjusted gross income. And what they're going to be looking at is if you're married, if you file your taxes jointly as a married couple, then there's different income brackets based on what your income was in 2019. If you file as a single, there's different income brackets for people who file as a single. We're not going to look at the chart today, but we do have that in a handout we're going to email out to everybody where you can look at the different income brackets. For most people, they pay the standard Part B premium, which is $148.50. But for people living in Fairfield County, you could have a higher income bracket where you pay an income higher amount. It's called income related monthly adjustment amount. And then on the right side of this chart, the coverage under Medicare Part B. When you use your coverage under Part B, the government charges a $203 Medicare Part B deductible. This is a one-time, once per year deductible. It's not per use of medical services. You only use it and have to pay it once. After you meet that deductible, then Medicare would jump in and start paying 80% of your medical cost for doctor visits, physical therapy, testing. You would be responsible for 20% of the Medicare approved amount. And we'll dive into that in more detail on the next screen. All right, so on this slide, what I want to show you is how original Medicare works with a Medicare supplement. So under Medicare, the government gives you two choices, two ways to get your Medicare coverage. You can get it through the original Medicare side. So under original Medicare, the government is the insurance company. So any claims that you incur under Part A and Part B, the hospital or doctors, that they're sending their bills directly to the government for payment. So under the Part A, the hospital portion side, Medicare covers up to a certain dollar amount. And then you have the option to add on what's called a Medicare supplement policy to help offset the cost that Medicare charges under Part A. So I had mentioned earlier, when somebody ends up into the hospital, that's going to trigger that hospital deductible of $1,484. And that's for a benefit period, a hospital stay of 1 night all the way through 60 nights. So that's the portion Medicare does not cover, the 1,484. If you had Medicare Supplement Plan G, the supplement plan would supplement, fill the gap, and pay that deductible for you. Now, Medicare Supplement Plan G, that's a separate insurance policy that you purchase. Right now, Medicare Supplement Plan G is the most comprehensive supplement plan that you can purchase. So I mentioned earlier, the way Medicare charges for hospital costs, it's based on the number of days that you're in the hospital. So a benefit period of 1 night all the way through 60 nights, you're only going to be responsible for that hospital deductible of 1,484. Now, if you're still in the hospital and you're approaching days 61 through 90, you're now entering a new cost sharing stage where Medicare is going to charge you a copay of $371 per day for those days 61 through 90. If you had Supplement Plan G, the supplement plan would fill that gap, cover that cost for you, and pay that. Now, if it's something serious and you're still in the hospital, now you're approaching days 91 through 150. At that stage, the copay really goes up. Medicare is going to charge you a copay of $742 per day for those days 91 through 150. So think about the people that have been in the hospital with COVID and how many days they spent in the hospital. I mean, they've been in there for months. So by having Supplement Plan G would absorb those costs and pay all those costs under the U-Pay column, the hospital deductible, the $371 copay charges days 61 through 90, and the copay charges of $742 per day, days 91 through 150. And then under the Part A hospital portion, Medicare does provide some limited coverage for skilled nursing facility care. Medicare will cover up to 100 days for medically necessary skilled nursing facility care. It has to be medically necessary. For Medicare to cover your costs under Part A in a skilled nursing facility, they have a requirement where you need to have been in the hospital where you had a 3-night prior hospital admission, meaning you were admitted and not under observation. You have to be admitted into the hospital. So if you meet that requirement and you're going to be sent from the hospital to a skilled nursing facility, and you had a 3-night prior hospital admission, Medicare will cover the first 20 days 100%. And then if you're still in days 21 through 100, that's going to trigger the copay of $185.50 per day. Supplement Plan G would pay those copay charges. And also under Medicare Part A, the governments can provide coverage for hospice care and also coverage for blood work. So those are the costs under original Medicare. And then by having Supplement Plan G would pick up those additional costs Medicare doesn't cover under Part A. Now, under the Part B, the medical insurance side, first time you use your coverage under Part B, whether you go to the doctor for a sick visit, that's going to trigger that $203 annual deductible. It's a once per year deductible. It's not per service. So once you pay that $203 deductible, Supplement Plan G does not cover that cost. And actually, none of the supplement plans cover that Part B deductible. So that would be your responsibility under the original Medicare side. After that's been paid by you, any remaining medical costs from that doctor visit or any future medical visits, Medicare will now start paying 80% of your medical cost. You would get billed the remaining 20%. Now, by having Supplement Plan G would pick up those 20% charges. Now, I want to point out those 20% charges that Medicare doesn't cover. The government does not put a cap on those 20% charges, meaning, if you pay the first $2,000, then the government will pick up everything after that. That's not the case. There's no limit to those 20% charges. So this is a big reason people who choose the original Medicare side, they do get some form of a supplement plan to cover those 20% charges or protect them from those costs. And then, excess doctor charges, supplement plan would pick that up. It's actually not allowed in the state of Connecticut. Lab work would be covered 100%. That's going to Quest for blood work. Also under Part B, there is some coverage for home health care. It does have to be medically necessary. Also durable medical equipment. Medicare is going to cover 80%. The supplement plan would pick up the 20%. If you needed an outpatient procedure, whether at the hospital or a freestanding facility, Medicare will pick up 80%. You would be responsible for the 20%. Supplement Plan G would pick up the 20% charges. There's also coverage for blood. So that was the Medicare, original Medicare with a supplement plan. That's just one supplement plan that's available. There's multiple supplement plans. Unfortunately, we don't have enough time to go into all the different supplement plans, but we did want to show you one supplement plan G. Now under Medicare, your other choice, the other way the government gives you to get your Medicare coverage is you can get your coverage through what's called Medicare Advantage, also referred to as Medicare Part C. Now, what Medicare Advantage is basically the government is outsourcing Medicare to the private sector, to private insurance companies like Aetna, Anthem, United Healthcare, Connecticut, and they're contracted with the government to provide all your Medicare Part A hospital coverage, all your Medicare Part B, the medical insurance coverage, and most plans bundle in the Medicare Part D prescription drug coverage. So the Medicare Advantage plans, they are contracted by the government, and what they do is they set up, they kind of look like your traditional coverage you had under employer plan, where they set up different cost shares based on the type of service you would use under Medicare. So if you go to your primary care doctor for a doctor visit, they would charge you a copay. You go to a specialist, whether it's a dermatologist or a cardiologist, they're going to charge you a copay. Some of the plans charge a $45 copay or a $40 copay. If you end up in the hospital, they would charge you a copay, or some plans they charge a hospital deductible. Every plan's different, so we help you understand how the different Medicare plans, Medicare Advantage plans are structured. One of the key things with Medicare Advantage plans is they set up networks of doctors. So they contract with the doctors that agree to participate in the plan. They're very good networks. Some of the networks are HMO networks, which stands for Health Maintenance Organizations. Under an HMO network, you do have to see the providers that participate in the network. You cannot go out of network. Some of the plans do give you access to a nationwide network. You also have access to what's called a PPO network, where you can go out of network. If your provider was not listed as participating in the network, you would be charged a higher cost share by going out of network. Some of the plans do give you access to their nationwide network through the United States. Most of the PPO networks, you have access throughout the country. So what we do is we do like to get a list of your providers to check the Medicare Advantage networks, so you know exactly what your costs are. So if you're going to the doctor, you know if he or she is in network or if they're going to be out of network. One of the things with Medicare Advantage, sometimes they don't have some of the major hospital networks like Memorial Sloan Kettering or the Hospital for Special Surgery. One thing I didn't point out on the original Medicare side What's nice with the original Medicare side is there's no network. You can go to any doctor, any hospital that accepts original Medicare. You can just go. That's throughout the United States and US territories. So I would say the key differences between original Medicare. On the original Medicare side, think of original Medicare as strictly coverage for medically necessary care. It has to be something wrong with you. The doctor needs to diagnose something. Original Medicare does not provide any extra benefits for coverage if you want to get your eyes checked for a routine eye exam. There's no coverage for dental coverage. There's no eyeglass or eyewear reimbursement or contact lenses. There's no hearing aid coverage on the original Medicare side. On the Medicare Advantage side, they like to throw in those extra benefits where they do provide some coverage for a routine eye exam. They do cover some reimbursement towards eyeglasses and contact lenses. Some of the plans give you dental coverage. Some of the plans provide coverage for hearing aids and a routine hearing aid test. Now, you may have seen some commercials on TV for Joe Namath, the famous Jets quarterback. Those commercials, he's pitching Medicare Advantage plans where he tells you everything's cost nothing. Those plans are really designed for people that have really low incomes and qualify for what are called dual special needs plans, where you can get extra help covering your medical costs. A lot of these Medicare Advantage plans like to do a zero premium plan, where they do not charge you a premium to be a member of the plan. Now, earlier we looked at where Medicare, under Medicare Part B, you have to pay a premium, that $148 Medicare Part B premium. If you choose to get your Medicare coverage under a Medicare Advantage plan, you still have to pay that Part B premium to the government. It doesn't matter which side you get your Medicare coverage, whether it's original Medicare or a Medicare Advantage plan. To join a Medicare Advantage plan, you do have to have your Medicare Part A and Part B coverage set up, and you have to live in the state where they do offer Medicare Advantage plans. And there is a little mistake here. They are covering end-stage renal disease for next year in 2020. So that was a high-level overview of Medicare Advantage. It's easier to show you how they work when we get a list of your doctors, and we can go in more detail with the different carriers and how the Medicare Advantage plans are structured. These are some FAQ questions. What if I have coverage, other coverage through an employer? So if somebody is turning age 65 and they're still working and covered under their employer plan, there's some rules under Medicare. It depends on the number of full-time employees that the employer has. So if you work for a company where they have more than 20 full-time employees, you can continue to stay on your employer coverage and you do not have to sign up for Medicare. And then down the road, if you decide you want to retire and start Medicare coverage, you would be eligible to start Medicare because you have what's called a special enrollment period where you could start Medicare at any time. When can I join and switch or drop a Medicare Advantage plan? Medicare has different enrollment periods. So you can join a Medicare Advantage plan. If you are turning 65, you're becoming newly eligible for Medicare. On the next slide, we'll look what that enrollment period is. Or if you have Medicare and you're an existing Medicare member and you have a Medicare Advantage plan, you could change your Medicare Advantage plan during the Medicare annual election period, which runs October 15th through December 7th. Or if you have a Medicare Advantage plan and you don't do anything between October 15th and December 7th, you could make a change during the open enrollment period, which runs January 1st through March 31st. Can I make changes to my coverage after December 7th? people who have Medicare Advantage, you can make a change. I just mentioned this earlier. Between January 1st and March 31st, that's only for people who have a Medicare Advantage plan. If you're on the original Medicare side where you have a standalone prescription drug plan, you can only make that change during October 15th through December 7th. What if I have a pre-existing condition? Good news, under Medicare, there's no pre-existing medical conditions. It's guaranteed issue in the state of Connecticut. So there's no pre-existing medical conditions, so you don't have to worry about that. However, if you do live in a different state, some states, after you've been a Medicare member and you want to change your plan during the year, they do have some pre-existing medical conditions. But under the state of Connecticut and New York and Massachusetts, there's no pre-existing medical conditions. How do I join a Medicare Advantage plan? Well, you can join when you become eligible or during the annual election period. And then note during the January 1, March 31st, you cannot switch from original Medicare to a Medicare Advantage plan. And you can opt out of a Medicare Advantage plan and switch back to original Medicare and set up a prescription drug plan. That's your options from January 1st through March 31st. Okay, so comparing your Medicare options. I kind of touched on this earlier, but this is kind of a side-by-side comparison. So on the left side, original Medicare, that's going to be the side where the government is the insurance company. So again, with original Medicare, it's an open network. There's no network of doctors. You can go to any doctor, any hospital in the country. They accept original Medicare, which is this red, white, and blue card. You can go to any hospital, any doctor. They take original Medicare. You just go. There's no questions asked, whether that's Connecticut, New York, anywhere in the United States. Medicare will cover 80%. You would be responsible for the remaining 20%. And then you also need to set up a separate standalone prescription drug plan. Those premiums can range as low as $7.20 all the way up to $100, depending on your prescription drugs. What we would do is run your prescriptions against all the prescription drug plans to see how your prescriptions stack up against the available prescription drug plans and which plan provides the best cost and the best coverage. If you have a supplement plan, you could have minimal out-of-pocket costs, where you just pay the Medicare Part B deductible or some small cost shares depending upon the supplement plan. And again, with original Medicare, the government does not provide any coverage for dental, getting your eyes checked for routine eye exam, or any hearing aid coverage. Now, on the Medicare Advantage side, the doctors are contracted under the Medicare Advantage plans. They set up either an HMO network where you have to see the doctors in the network. A lot of the plans are actually doing PPO networks where you have access to in-network doctors and you can go out of network. Most plans don't require a referral. A couple plans do, but most of them are open access. You do have some lower out-of-pocket costs just for routine medical visits, for your doctor visits, and the premiums. A lot of these Medicare Advantage plans like to do zero premiums. And with the Medicare Advantage plans, they do bundle in, most plans bundle in the prescription drug coverage. So that's all. Think of Medicare Advantage as your all-in-one plan, covering all your Part A hospital coverage, Part B, the medical insurance coverage, and the Part D prescription drug coverage. And they are including the extra benefits most plans do. We can get coverage for routine eye exam, also dental coverage, and hearing aid coverage. Now, they do have vendors that they work with. So you would need to use the vendors they work with for those extra benefits. Some plans do allow you to see participating dentists that are not in the network. Let's go to the next screen. All right, this is the Medicare Part D prescription drug coverage portion of Medicare. This is by far and away the most confusing part of Medicare. I could spend a whole hour on this slide. It's very confusing, but I'll try to summarize it to make it as easy as possible. Basically, under the Medicare prescription drug coverage, it's a standardized benefit. So whether you get your prescription drug coverage through a standalone prescription drug plan under the original Medicare side, or you get it bundled in with your Medicare Advantage plan, it's the exact same benefits where there's a deductible stage. Right now for 2021, the maximum deductible the prescription drug coverage plans can charge is $445. A lot of plans waive that for generic drugs where you don't have to pay that deductible. It usually applies for brand name prescription drugs. So with prescription drug coverage, the key part is this part right here, the initial coverage stage. So that $4,130 amount that you see, think of that as your starting pool of money. Everybody starts out with that same pool of money during the year. And this is for 2021. That pool of money gets reduced each month by the retail cost of your prescriptions. You're not paying the full $4,130. You may only pay a copay for the prescription. So for example, if you're taking XYZ drug and the retail cost is $100, you may only pay a copay of $30, but it's the $30 that you pay and the $70 that the plan pays makes it to that $100 retail charge, and the $100 gets deducted from that $4,130 each month. I'm not going to go any further with the prescription drug coverage. Really, the best way to understand it is if we can get a list of your prescriptions, we can run them against the prescription drug plans and show you exactly where you fit in based on the different stages of the prescription drug program. It's all based on the retail cost of your medications. All right, so applying for Medicare. So this is for people who are turning 65. So if you're approaching age 65, you're going to be option 1, and then option 2, that's going to be for people who are over age 65 and are looking to retire and leave employer coverage and start Medicare. So we're going to look at option 1 first. So option 1, you're turning 65. So anybody who's approaching age 65, you are going to be entering into what's called your initial enrollment period. This is a 7-month period that starts 3 months before the month you turn 65. It includes the month you're turning 65. And then you also have 3 months after the month you turn 65. So this is the time of year where you want to let the government know what your intentions are if you do in fact want to start Medicare when you're turning 65. So if you know you're not going to be covered under your employer plan, you're going to start Medicare, we recommend you get the process started 3 months prior to the month you turn 65. What you're going to be doing is you're going to be signing up for this red, white, and blue Medicare card. So you can start that process 3 months before the month you turn 65. So if somebody's turning 65 in January, your 3-month window would start in next month, October. So October, November, December, that's the 3 months before the month you turn 65. Now for the procrastinators, people that don't do anything during the first 3 months, the government gives you 3 months after you turn 65. But if you wait until after you turn 65, that's going to delay your enrollment into Medicare Part B, which is the medical insurance coverage. So the ways you can sign up for Medicare right now, you can apply online. Right now, most of these Social Security offices have been closed. So people have been signing up online through the Social Security Administration website, ssa.gov. So there's a simple application that needs to be filled out. You may have to open up a My Social Security account if you haven't already done that. Another way you can apply is you can apply in person if the Social Security office is open. So you would find the local Social Security office for people in Fairfield County. It's either going to be Bridgeport or Stanford, depending upon where you live. Or you can also call your local Social Security office and schedule a phone appointment where you can do your application for Medicare Part A and Part B over the phone. So you have three options. You can apply online, you can apply in person if the local Social Security office is open, or you can do it over the phone. We can walk you through it and explain how that gets done. Then option number two, this is for people who are over age 65 and are looking to retire, come off their employer plan. The sign up here is a little bit different. There's a couple forms that have to be filled out. There's an employer form that your employer has to sign off on, stating that you did have employer coverage under the employer plan when you turn 65. And then there's a Part B enrollment form. So there's two forms that have to be filled out. Sometimes when people leave employer coverage, they're offered COBRA. Medicare has strict rules. When somebody accepts COBRA, the government does not recognize COBRA as continual coverage. So be careful. You have 8 months to sign up for your Medicare Part B coverage. If you elect COBRA, if you don't do anything after that 8-month period, that's going to delay your enrollment into Medicare Part A and Part B, and you're going to get charged a penalty. So be careful if you decide to look at COBRA as an option when you leave your employer plan. There are very strict rules, and we want to make sure you don't get charged a penalty. So here are the forms I mentioned earlier. There's a request for employment information form, and then the application for enrollment in Medicare Part B. We have these forms available. Feel free to give us a call. They're also available under the Social Security Administration website. We can explain the different time frames when to sign up. So we got to move a little faster here. This is a program available in the state of Connecticut. It's called the Medicare Savings Program. This program is designed to help individuals. If your income is below a certain level, this program is only income based. It does not look at your assets. This is going to help offset the cost under Medicare Part A and Part B, and also help with your prescription drug cost. This program will also cover your Medicare Part B premium, which is that $148.50, the standard Part B premium, or if you're in a higher income bracket where you have to pay a higher Part B premium, this would help offset that cost as well. There's 3 different income levels. It's based on if you're a single or a couple. So you can see the different income brackets. So it depends on what your current monthly income is. Monthly income would include Social Security, any investment income, any rental income, any income that would feed over to your tax return. So we help people get set up on this program. So that's kind of a super high level overview, covered a lot in 45 minutes. We're a local resource. So we have an office here in downtown Fairfield, and we meet with people one-on-one. Medicare, it's personal. Everybody has a different health situation. Everybody takes different prescriptions, different doctors. So our goal is really to help you navigate and understand original Medicare with a supplement plan and a prescription drug plan, or whether it makes sense to look at a Medicare Advantage plan run by private insurance companies. And we help you understand, make sense of all the different options available to you. Does anybody have any questions? I see a question here. Mark, you've been answering some questions. Does anybody have any questions? I don't know if everybody's on mute. I think we're good. Ellen, any questions out there?
Yeah, I'll just ask if anybody has any question. Someone commented, says, thank you so much for being here this evening. And I would also like to say thank you to Curtis and Mark for this very informative and helpful event on what is a complex situation. We do have one question. What changes do you expect for 2022?
So some of the changes every year, the government looks at everybody's income. So in 2022, people that are starting Medicare or in the Medicare program, they're going to look at your 2020 income to determine your Medicare Part B premium. The Medicare Part B premium will most likely go up a little bit. The government does adjust that every year. The supplement plans do make some premium adjustments. So those do make some changes. Prescription drug plans, they're always making changes to their formularies, which is the covered drugs they cover. So that's always good to take a look at. The Medicare Advantage plans like to add in some extra benefits or change the copay structure. So there's always changes. It's always good to review and make sure you still have the best coverage for that year.
That was a very good answer. Thank you. Are there other questions? Let's see in the chat. Okay. There are 3 questions outstanding. Is there any particular supplement plan you recommend?
We're not technically allowed to make a total recommendation, but we like to show people 3 supplement plans. We recommend, well, there we go. Supplement Plan G right now is the most comprehensive supplement plan. Another supplement plan that's very popular is Supplement Plan N, as in Nancy. And another one a lot of people aren't aware of is what's called High Deductible Supplement Plan G, which takes that Supplement Plan G that we looked at the presentation and adds a deductible to it. That's going to be your lowest premium plan. So that's a unique supplement plan, and a lot of people like that plan. So it's personal preference, but we help you understand how the different supplement plans work and what they cover and what the costs are.
Okay, and then we have one other question is, how is your firm compensated?
Oh, good question. Very good question. So we are health insurance brokers. So we actually represent you, the consumer. So we actually get paid by the health insurance plan. So if we set you up, whether it's a supplement plan or a prescription drug plan or a Medicare Advantage plan, we would get paid by the health insurance carrier. And the premiums for the supplement plans, the prescription drug plans, and the Medicare Advantage plans, they're the same premiums, whether you do it on your own or you work through a broker like myself or Mark. There's no difference in premiums. So basically, working with us, you get our expertise, and we can save you a lot of time navigating and understanding how these plans work and what the different costs are and what's covered.
Thank you. We have one other question. Is there a limit on home health care visits?
So home health care under Medicare, it has to be medically necessary. So we're seeing a lot where people are having knee replacements, hip replacements, surgeries. And instead of being sent to a nursing home, people are being sent home for home health care. So as long as it's medically necessary, that will be covered. Now, if it turns into a long-term care situation where everything's been done medically, possibly to bring you back to normal, and you just need assistance with the activities of daily living, like bathing, dressing, eating, or if somebody had a cognitive impairment, that's going to be a long-term care situation where that would turn into long-term care. Medicare is not going to provide any coverage for that. It has to be medically necessary.
Okay, we have to cut the questions off at this point, unfortunately. But just other one quick question was the premium for Part G. I think Mark had answered that earlier. I think that was in range of, let's see.
In the $200 range.
Yeah, it was the
Depending on the
$200
carrier.
range. Yeah,
That could change for next year a little bit.
okay. And also, do you provide long-term care?
Yes, we do. We
Okay.
can help you. And that's where we got started, actually, in the long-term care industry.
All right, well, I want to thank you very much to both Curtis and Mark for this very informative and helpful event on what is a complex situation. Tomorrow night, we will be hosting an in-person networking event for job seekers and business people between 7 p.m. to 7:30 p.m. in the Kamansky Room at the library. Please join us for this informal event where we will share tips about job search and networking. Please register on the Westport Library website, www.westportlibrary.org. And again, I want to thank our presenters, and I want to thank you, the audience, for coming tonight and supporting the Westport Library. Thank you very much.
Thank you, Ellen. Thank you.
Thank you.
Thank you, everyone, for participating.